Hi, this is Dan Capron. I'm a workers' comp lawyer, and I'm here to tell you about medical benefits under the Workers' Compensation Act. One of the most important benefits that's contained in that law, and again, this is a law that covers you if you get hurt at work, is the right to get medical treatment. But unfortunately, that right is not unlimited, and there are some constraints that the law has put upon your ability to get medical treatment. You need to be aware of these. Most of the time when you get hurt, you'll be asked to go down to the company clinic. And that's usually fine, at least initially. We're talking about one of those dock-in-the-box places or maybe a local emergency room. At least to begin with, that's okay. But bear in mind, in the state of Illinois, your employer does not have the right to direct or to steer your medical treatment. You have the right to treat with not just one, but two doctors of your own choosing, not counting referrals. So let's take a typical scenario. Let's say that you get hurt at work and you go to the company clinic and they patch you up, maybe take an x-ray, and they send you home. You now have the right to consult your own doctor. Many times somebody will go to their primary care physician, and that's okay, because the primary care physician can either address the problem or can refer you to a specialist. The primary care physician would count as your first choice of doctor, but the referral to the specialist would not count as an additional choice. So the orthopedic surgeon that you get sent to, that still counts as doctor number one. And if you become dissatisfied with that doctor, you still have another choice that you can exercise to go to doctor number two. But beware, if you ever find yourself going to doctor number three of your own choosing, the law says that the Workers' Compensation Insurance Company does not have to pay for that. Now, there are some limitations on the amount of the medical bills. That typically doesn't affect the injured worker so much as it affects the doctor. There's a fee schedule that regulates and controls the amount of the doctor's fees in an attempt to keep costs down for workers' compensation. But again, that typically doesn't affect the injured worker. The employer does have the right to send you to a doctor for one reason and one reason only, and that's for the purposes of a medical evaluation. Again, this is not treatment. This is just for an exam, to try to get a handle on the extent of the disability, what type of a condition it is, and typically whether it's work-related or not. You do have to comply with that request to go see a doctor for an evaluation, but the insurance company has to provide you up front with travel expenses, and on the back end with full reimbursement for any lost wages that resulted from having to keep the exam. If you have any questions about medical treatment, medical exams, or any other aspect of workers' compensation, ask your steward, ask your BA. They can point you in the right direction.